Hello everyone, this is Dr. Sanjana Kumar, consultant OB-GYN, high-risk pregnancy specialist and cosmetic gynecologist. Today I am here with you to discuss a very common and a very important issue, that is polycystic ovarian syndrome, commonly known as PCOS or PCOD. I am sure all of you have heard this because every alternate girl these days is suffering from PCOS because of the sedentary lifestyle, stress and so on. But I am also sure that many of you have a lot of misconceptions, anxiety and doubts about this problem. Many of you actually think there are some cysts in the ovary, there are some bubbles in the ovary because of which there is problem, it has to be removed and so on. But today I want to make it clear to you that the basic problem in PCOS is because of hormonal imbalance. Whenever you gain weight or whenever you are undergoing a lot of stress, when you have a sedentary lifestyle or you're eating unhealthy food, junk food, what happens? The body fails to maintain a balance in the hormonal system. Because of the hormonal imbalance, you get all the signs and symptoms of PCOS, the commonest being menstrual irregularities. You could also have scanty menstrual flow, rarely heavy menstrual flow, acne over the face, excessive facial hair, lot of hair fall from the scalp, darkening of the neck, pigmentation over the neck, fatigue, low mood, abdominal cramps and so on. And because I said there's hormonal imbalance, though there are a lot of eggs in the ovary, they do not get released. They sit there, the follicles, the ovarian follicles are there in the ovary. And when we do an ultrasound, it appears as though there are multiple cysts. That's why the name polycystic ovarian syndrome. So if you ask me, what's the problem with this PCOS? Why do we have to be bothered? What are the implications? See, first thing is there's menstrual irregularities, acne, facial hair, all this will cause a lot of disturbance to your mind. Apart from that, when you're planning on a pregnancy, it could be difficult for you to conceive naturally. Because though there are a lot of eggs, they are not getting released. Ovulation is not happening. So you might need some ovulation induction or treatment for the eggs to get released. And once you become pregnant, there could be higher chances of you developing diabetes in pregnancy. Moving on further, you could develop diabetes, hypertension, thyroid illness, thyroid disorders later on in your life. And one more important thing is, because of the hormonal imbalance, there could be abnormal growth of the endometrium, which is the lining of the uterus, leading to endometrial cancer in the future. Don't worry, this will not happen to everybody. I'm just telling you that there will be increased risk of developing endometrial cancer. So how do we tackle all this? How do we prevent all this? You know, I've told you the pathology. You know why PCOS is happening now. So you know the treatment as well. So the mainstay of treatment is lifestyle changes or lifestyle modification, healthy diet, daily exercise, weight loss in some cases and reduce